This is our community health promotion plan. We chose to do ours over the Veteran Outreach Center in Sioux Falls, and this has been put together by Melanie Lawal, Stacey Butch, and Angela Toledo. To begin with the Volunteers of America Veterans Outreach, it is here in Sioux Falls on 1113 East 14th Street, Sioux Falls, South Dakota 57104. And they provide drop-in service to veterans and homelesses. They're closed 2 days out of the year on Thanksgiving and Christmas, and they're open Monday through Saturday from 9 to 4:30. And they provide a large amount of services from laundry, showers, restrooms, computers to help them build resumes and job services, different VA services, snacks, sometimes just a warm place to stay, phones, addiction meetings, HUD, VHSA meetings, and emergency support for 9/11 veterans. And here's just a picture of the Veterans Outreach building. Currently, their health promotion activities are transportation. That's a big issue that the homeless will have, is getting back and forth. So they provide transportation to the VA and other healthcare needs. Visits from nurses from the VA. They'll just come there and visit at the outreach center, so that way it cuts out some of that centerpiece, making appointments, scheduling, and finding rides. Free food and nutritional needs, clothing for veterans and families, mental health for veterans, social worker, counselors, and groups to address different mental health needs, case managers to assist with daily needs, assisting the needs of veterans and families, and assisting with resources. They have a frequent contact for homeless staff at the VA. They have a grant per diem program and a transitions in place program. Now, with the grant per diem program, that's required to have a physical exam, a psychological assessment before entering. Each veteran's required to maintain sobriety and establish a source of income, a checking and a savings account, and attend a minimum number of recovery activities per week as determined by the program. Now, the Transitions in Place program provides 6 to 12 months of case management and different supportive services in addressing the barriers that the veteran may have contributed to them becoming homeless, and things that they could do different in residing in a safe home. And with the Veterans Outreach, they're able to really just meet the veterans' needs and assisting them and finding the resources that are out there. Sometimes they don't know what resources are even there, so promoting what's available to get these veterans back on their feet. What could be different? Well, a big thing is that the nurses on staff can be the case managers. Currently, they are not. So they'd be able to immediately look at these healthcare needs, their feet, checking for frostbite, answer health-related questions, skin issues, recognize some of the sexually transmitted infections, nutrition, dependency issues, and just eliminate that middleman that, okay, you have to see your caseworker and now you need to see the nurse and there are all these appointments. So if we transition to have more caseworkers that were actually nurses, that would make it a lot easier, because we'd be able to handle these things right on the front end line, making it so much more streamlined for these veterans that are coming into this facility. With the NANDA nursing diagnosis, ineffective health maintenance related to inability to make appropriate judgment as evidenced by unmet healthcare needs, inability to recognize need for medical attention, homelessness, and lack of healthcare knowledge. Veteran did not know the signs and symptoms of diseases or illness. They have lack of immunizations, unmet self-care needs, self-verbalization of lack of knowledge, and when to ask for medical help, communicable diseases, basic needs, and ongoing health problems. With the Healthy People 2020, according to Healthy People 2020, access to health services means timely use of professional health services to achieve the best outcome. The big thing is just being able to get there and do what we need to do, and having this all figured out is a big thing. access to a location where needed services are provided. And this is what the Veterans Outreach is. It's a place that we know you can go and find more information on services and hopefully not get the runaround. Overall physical and social and mental health statuses. You know, they want people to be healthy in general. They want to give them that quality of life that they need. And it starts off with just one thing, and you're able to snowball it into more of a total effect. Prevent diseases and disabilities. Like I said earlier, having that nurse as the caseworker, they may be able to see signs of something early on, and just because they're homeless doesn't always mean that, you know, they're not trying or they're not willing to do things. Detect and treat diseases. You know, we need to give them a place that they can come and the resources they need to actually fulfill the treatments that they have for these diseases. It's not easy if they're homeless, but if we're taking all of the resources that we have together and pooling them, then it's going to make it a lot easier for us to provide the care that we need for them, the education that they need, and the resources that they need to get better and to have a better life outlook in general. For our nursing theorists, we chose Florence Nightingale. To Florence Nightingale, a person is defined as their relationship with the environment. She believed that the environment was a major cause of disease. And in some cases, this is true, especially here in South Dakota when it's so cold in the wintertime and the on and off temperatures. You know, you are going to be more likely to get sick, especially if you're homeless. Symptoms of disease were due to lack of cleanliness, and that can also be true if you're unable to clean an area, if you already have diabetes, and you don't recognize that sore on your foot. It's going to cause more issues in that area. As nurses, she believed that we must give them the best environment. And that's what we're trying to do. We're trying to give them all the possible resources to get them set up in a clean, warm environment. It may not be anything fancy, but it's a good environment that they can use as a starting point to continue to get better. Health promotion is a fact of eliminating the environmental factors that cause disease. And that's what we're trying to do here. If they're homeless, they have, you know, no clean place to go, places to do laundry, places to shower. And the Veterans Outreach Center is trying to provide a part-time assistance with that, but also utilizing all of the different opportunities that they have to get people set up in a long-term place where they can be warm and be able to bathe and do laundry. And there's so many different resources out there, and that's what their intention is to give them more information and be able to help them become cleaner and get rid of these diseases and recognize these things at an earlier stage. And here is Miss Florence Nightingale. And it is true, it's about caring and being able to take care of these people and letting them know that although they're not in the place they'd like to be, that they're not alone and that there are people that are out there trying to help them and educate them and not being judgmental. And here are the resources that we have used for this presentation, and we'd like to thank you and have a good day.